Okay, so let's talk about upper extremity nerve flossing. So what that means is you have nerves that come out of your neck and they go down and all the way down your arm to your hand. And what can happen is sometimes along that track, you can have compression from muscles or other soft tissue, and that compression can lead to symptoms further down, such as numbness and tingling, or even just pain. So what we want to do is we want to make sure that the muscles aren't impinging or entrapping on the nerves, so we can take care of that with stretching, lacrosse ball rolling, trigger point release, and other forms of therapy for the muscle tissue. We can help the joints move better in the neck, which is where the nerves come from. And then we can also do what's called nerve flossing. So think of a piece of string going all the way down the length of your arm. Basically what you're trying to do is get the string to go down, get the string to come back, get the string to go down, get the string to go back. So that's essentially what we're thinking about with nerve flossing. We're thinking about the nerves gliding, and it's not just the nerves, it's the vasculature, it's all the soft tissue that runs down through these lengths of the arm. We're just trying to make things less entrapped. We're trying to free tissues up and allow them to glide and slide better so that there's less compression and less symptom provocation. So there's a few ways to do it. There's different techniques called glides and tension techniques, but let's keep it simple for today. And I'm going to show you a way to really kind of get that whole upper extremity. So what I want you to do is take your hand, bend it back, and you might start to feel some tension here, all the way even up through here, through the back, even sometimes into the neck. So simply what you can do is standing here, arm out to the side, even just going back and forth like this is a pretty good starting point. If it feels really intense, you don't want it to be too intense. So what you can do is take some of the tension off by placing your neck in a different position, but you can go back and forth with your hand. Okay, what you could also do is take your arm at different angles because you'll start to feel the tension differently. Okay, so I'm up here going back and forth. Now if I rotate my hand up and go up and down, that's going to tension it differently. And if I take my head into a different position, that's going to tension it differently too. So find where you feel the tension the most and go for about 10 to 20 reps. And what you should feel is over time, it should really start to ease up a little bit, loosen up a little bit. To take it one step further, sometimes what I'll do is I'll put my hands on an object. So I'll put my hands on a piece of equipment and I'll just take my head side to side. Okay, I'll turn my head to a different angle, up and down. I'll put my arm on a wall. I'll put my arm on a wall in different angles. I'll turn my arm, and I'm really just trying to find where's the tension and how can I really use these approaches and techniques to loosen up that tension so there's less limitation in my ranges of motion and less symptom provocation. So give that a shot. Try it 2 sets, go for 10 to 20 reps, then retest your ranges and see, hey, is it more comfortable when I go back into these ranges? You should see improvement within the 2 sets. You can do this a couple times a day. Start slow and work your way up, because if you do too much too soon, sometimes you can just irritate the tissues because you've tensioned it too much. So slow and steady, ease into it, work your way up.